Hello, hello, Heal Squad. It's going to be a great day because we are going to learn so much today from our guest. You guys have no idea. If you think it's just a baby show, it's not. It's for you as an adult, and you will see why when we start chatting. But first, our quote of the day: no language can express the power and beauty and heroism of a mother's love. That is by Edwin Chapin. And I know that I'm going to feel that beauty, power, and heroism soon. So that's why we're doing Baby Week. Really, really excited about our guest today. We had such a great conversation. I learned so much. But also, like I said, not just for baby. I always curate shows based on what I'm needing in the moment, hoping that other people will be needing the same thing. So maybe there are new moms in their later years that are going to need this information. But there's so many things that we learned and discovered today as adults that are really powerful, that maybe when we were born, we just didn't know about. I know that's the case for me specifically. So Danielle Gauss is an international board certified lactation consultant, certified childbirth educator, and she's the author of Booby Fairy's Guide to Breastfeeding, Veggie Tales, Memoirs from Down Under. She's trained in oral tethering, which we just learned about today, specializing in the identification and treatment of lip ties, tongue ties, buccal and posterior tethering. She specializes in proper body work following frenectomy, including the importance of acupressure calming points. Over the course of her 17-year career, she has assisted in numerous births and helped educate thousands of women about the birth process and breastfeeding needs of their infants. She had the unique opportunity to work both in a hospital setting for 4 years and pediatric office for 9 years before settling into her new home base in Irvine for the last 4 years. We learned so much in this interview, and I'm so excited for you, Heal Squad, to have a listen to my conversation with Danielle. So Danielle, thank you for being here.
Thank you for having me.
I'm really excited for this Baby Week because I always curate content based on my needs because I know that there's other people that are going to have the same exact needs, but usually it's in health and wellness. But I feel like this is health and wellness, but for a baby.
Absolutely.
So tell me a little bit about your journey to here, because of course, we've been watching you on TikTok and your videos are so engaging and so informative. And I love that. Tell me kind of how you got into all of this.
I ended up in medicine kind of a roundabout way. I was a mom, just like everyone else. I was a theater major in college, was in a Lamaze class very young, and realized I didn't want to stay at home. I wanted to stay at home with the kids. I didn't want to have to be out working all hours of the night. And I was like, I can totally do this. This is monologues about uteruses. I can absolutely do this. So that started my journey into motherhood. But I went into lactation after the birth of my second daughter, when everything that could go wrong went wrong. She was completely different than her sister, who is 21 months older. Personality, health, gut, everything was different. And I remember staring at her at 6 days going, oh my stars, I can't feed you. Became a total closet bottle feeder because of the stigma that was around that, which I've spent my whole career, making completely different, because we just want to feed a baby. That's our number one goal. Yeah. And, number one, we feed a baby. And number two, we do what makes you the best mom for that baby. And so that sent me into this whole world. She ended up being tongue-tied, which 19 years ago wasn't really known, and the effects it can have lifelong weren't known. And so she was extremely colicky. I had postpartum depression. I just felt like I was drowning, and I never wanted any mother to have to go through what I went through. So I did what I always do, and I dove into research and completely shifted gears, making my parents legit mad that I actually went into medicine, which is
Wait, I've never heard of a parent be mad about their child going into medicine. Isn't that what they're always pushing everyone into?
That's what we would hope. But my parents were both, my mom was a high school theater teacher and wanted me to stick to the family business. So they were legit mad. My dad was a professional mime, so I swear that's why I'm afraid of clowns. Because it was the first face I saw. But I ended up, telling him like, this is what I want to do. And went for it and learned anything and everything I could do about it. And I worked in a hospital setting for 12 years before going into a pediatric office for 9. And now I have a private practice in Costa Mesa, California.
So that's interesting. So you became a lactation expert.
I did.
So what kind of certifications are required for that?
So my licensing is I'm an IBCLC, which is an internationally board certified lactation consultant. So it's an advanced practice healthcare provider, but specifically for the feeding needs of infants. And my practice is a little different because I also have training in craniosacral therapy. I do a lot of acupressure. I look at each mother-baby dyad as its own it's not cookie cutter, which I think a lot of practitioners, they get stuck in their ways and it's cookie cutter. Everybody has to be the same. And that's just not the case. I feel you have to think outside the box to meet the needs of the mother and the baby and to really listen. Babies are so aware from the minute they arrive. And if you just take time to look at them and listen to them, they'll tell you their story and they'll tell you what they need. And so I have made it a point to just keep learning. I've always said, if I'm done learning, I'm done practicing because medicine is constantly changing and we have to be open to new things and new research. And I'm learning something new every single day, which is what keeps it exciting and beneficiary for even the practitioners I work with.
I think that's so important is that continued passion for learning and growing because, and for all of us, not just someone in medicine, but I remember when I was interviewing pediatricians, that was a big thing for me. And I had to do it in a kind of sly way because I don't want to give them the answer. But I'm like, oh, so, what are your thoughts on, kind of alternative methods and whatever? And finally we get to that place where one of them was like, oh, I am a constant researcher. I'm constantly looking for new things. I'm like, you're my person.
And that's who you want to latch on to. Yeah. That's a gift. And that's rare in the pediatric world because there are so many, doctors are not taught about a lot of things regarding breastfeeding. They get maybe 5 hours of breastfeeding education, but even in regards to like oral tethering, they aren't taught that in medical school. So
I've never even heard of oral tethering before this. So
wonderful. I'm happy to spill it all.
Yeah, we're going to get into tongue tying and oral tethering and all of that. But I also love hearing that because the mission kind of behind this show is to really demystify kind of the medical system and what it really is, because I believe that we give up our power and our control and all of it to people. We don't really know what their training is. We just are assuming they've got a white lab coat on, that they know everything and they're God.
That's right.
And when you hear how little nutrition they get in education and how little they get in, even, a pediatrician in terms of some of these really important topics like breastfeeding, I hear so many stories about women having difficulties in that. And you're going to this person as the expert and you're taking their info as gold.
And they may not know. A lot of physicians are taught to wait for enough symptoms to treat a disease. In my field and a lot of the practitioners I work with, we focus more on preventative care because that's really, if you think about it, what it's all about is preventing issues in our children.
Yeah. I think you need to say that line one more time. What are they taught?
Physicians are taught to wait for enough symptoms to treat a disease, where in my practice and other care providers, we're taught for preventative care, to wait before something drastic happens, which is how, in my opinion, medicine should be moving forward. It's constantly changing and evolving, and you have to look outside the box. I can't tell you how often I have a mom come into my clinic that their birth story, how the baby was brought into this world, their breastfeeding journey, what have you. It brings to light things they didn't even know they had. And if you don't take the time to look outside the box and think differently, you're going to miss so much of what that individual mother-baby dyad needs.
So you've probably seen women be diagnosed with things based on their deficiencies in these areas. So like if
Absolutely.
they were having trouble with this area, they didn't know they had this. So maybe share some of that.
Absolutely. So a lot of that too, and what I try to is empower mothers because you know that baby better than anyone is going to know that baby. You know their cues, you know their smells, you know their facial expressions. And so I rely a lot on maternal instinct because you were designed to care for this child, right? So I am going to trust what that mother's instincts and guts say far more than anything of my knowledge or what other practitioners are going to say. Me as a mom myself, both my girls had really rare health conditions that had I not listened to my mom gut, my eldest daughter would not be alive. Grey's Anatomy literally saved her life. Season 15, episode 5. That's
No
a
way.
whole other story. Seriously.
Wow.
And had I not listened to my mom intuition, we would have never gotten to a diagnosis. And I see moms come in, for example, if they were to Google low milk supply, the first thing that will come up is fenugreek, which is an herb that can increase breast milk. However, in our new era of increased autoimmune disease, of how we're giving birth, how we're, increasing breast milk and what our environmental factors are playing a role into. If there's a mother who doesn't know she has an underlying autoimmune disorder or a thyroid condition, which is very prevalent postpartum, if you take fenugreek, you're going to actually dry up your milk because it lowers your blood sugar and your insulin levels. And your insulin is so crucial to producing milk. So if they just went to Dr. Google and typed in that without consulting a professional, they would have no idea. So then they come into my office, they feel defeated. They've been gaslit by the medical professionals that it's their fault their baby's not gaining. It's their milk that's the issue. When in reality, 8 out of 10 times it's actually the baby's anatomy that's causing the problem, or a simple positioning issue, or an undiagnosed thyroid condition that had the labs been drawn or this extra step taken, we would have known that and known that that is the worst herb you could take compared to something else that will actually support you.
See, that's so frustrating to me because there's so many things that I see in the medical system with just some minor adjustments that would get better. If you're going to be a new mom, why wouldn't they draw labs on you to make sure that you are all systems go for this phase of life and breastfeeding?
Agreed.
Right?
I wish it were a common practice, especially one test in particular is the MTHFR gene mutation, which is actually on the rise. And it is responsible for how a mom absorbs folic acid in pregnancy. And it is the direct link to the increase of oral ties, tongue tie, lip tie. In my opinion, it should be a routine test that happens because it makes all the difference in the prenatal care of whether or not that mom can absorb folic acid correctly. We give folic acid to pregnant moms all the time to help with any type of midline defect. But if the mother's a carrier of the MTHFR gene, which is becoming more prevalent, she needs methylated folate in order to protect from midline defects.
Ooh.
And those are tests that just aren't routinely run. Or at 6 weeks postpartum, when your whole chemistry has changed, every dynamic of your endocrine system is involved in lactating, or even if you're choosing not to lactate, that's still going to affect the different chemistries of your endocrine system. And so it should be something routine at 6 weeks. We're checking mom's thyroid and her insulin levels and her prolactin levels to see, is there any outside influences that could be a flag that's causing some of these deficits that she can fix either with her diet or with an IBCLC or, or her physician in general.
So with my surrogate, should we be testing these things now? I mean, we're like a few months away.
Yes,
right?
That's exciting.
So is that something that, are we already too late?
No, not at all.
Test all these things.
I do feel that will be a little bit different because there's different genetics at play. However, it is something that would be helpful to know for a surrogate carrier because there is still her nutrition at play with your baby, right? And so if she's not able to absorb some nutrients, and it would just be helpful for her overall health to know, because if it affects your mental health down the road. It affects any type of a midline defect within the body. So it's just helpful for anyone to be tested, period. But especially because it will give you kind of a precursor of, because it's your genetics involved as well, along with the gestational carrier of her absorption of nutrition. So it plays a role on both ends.
Well, also, if she has anything that's deficient, she might have problems giving us breast milk.
Absolutely.
And pumping, right?
That's right.
Lot of questions, but what is a midline defect?
So in the gestational period, while the fetus is developing, there is the midline of the body, right? So for tongue ties, for example, the same gene that you see babies have little stork bites, right? Or they'll sometimes have little strawberry kisses on their forehead. It could be an umbilical hernia, but most commonly anything within the midline as it develops, it can affect a tongue tie, a lip tie. It could be within the digestive tract, the cardiac history, anything within that area it can affect. So most commonly, it could be as simple as just a stork bite, right? Which is
what's a stork bite?
That is little red marks you'll see on the back of a baby's head. So we lovingly call it a stork bite in medicine because the stork brought them to you, right?
Okay.
And so that's the little love kisses that they gave, or the angel kisses is kind of what we call them.
Okay.
In medicine, it's a hemangioma, but we call them stork bites.
And that's if you have that gene, the M.
It can manifest in that way. Certainly, any type of midline defect you can have without having the MTHFR gene, but it is more prominent if there will be some form typically with that gene mutation that will cause that. So when I have a baby come into my clinic, I do an immediate full body assessment, right? So I'm looking for sucking blisters. I'm looking for that stork bite. I'm looking to see if the jaw's recessed. I'm looking pretty much all over because if I see any of those markings, the first thing I want to do is check the baby's suck. And I can tell an entire birth story from a baby's suck, just how they were delivered, because I've been feeling sucks for a long time. I have that knowledge, but you can tell an entire whether they've been induced and had Pitocin. How was their delivery? Is the baby holding on to tension in their body? Is there a tongue tie or a lip tie that's affecting how they're going to eat? Are they going to be gassy? Does that set them up for colic? But not only that, lifelong issues as well.
Yeah. You were talking about blood sugar levels and insulin and how important that is. I wonder how does all of that play when you're type 1 diabetic?
It plays a big role.
And also a lot of women become diabetic in their pregnancy.
Yes. So gestational diabetes is also on the rise. And especially because we as women are becoming, mothers later on in life. And, as we become older, our insulin and our blood sugar and all that can certainly shift as well. So gestational diabetes can be an issue. And so how your insulin levels adapt plays a huge role in a gestational period of the size of the baby, how they're going to be born, and of course, the dependency of your own body. So if it's a type 1 diabetic, we already have that standing history. We're checking your blood sugars often. So it's much different than a type 2 diabetic, which can be diet controlled. So in pregnancy, if they're gestational diabetic, a lot of times they can control it. It kind of falls more under that type 2 diabetic category, because once they have the baby, they can heal from it.
But how does it affect lactation and breastfeeding and all of that? Is it harder for people with diabetes?
It can be. It can go one end or the other. I've seen it both ways, but it is something to keep in the back of our minds, because if they will be more prone to a lower supply. So tools to increase their supply will need to be monitored, meaning they need to have, every lactating woman needs at least 75 grams of protein. That's important, lots of fluids and taking care of their nutritional needs specifically. But if the mother happens to be diabetic or has insulin insufficiency, that's going to be completely detrimental to her milk supply. So she needs to monitor her carbs and her protein and make sure she's taking specific herbs and relying mainly on stimulation and supporting our hormones versus truly relying solely on what she's intaking, if that makes sense.
Yeah. Okay. We got to get into tongue tying.
Let's do it.
and then we'll get into
It's my favorite.
lactation. But I saw that video of you and you're in this baby's mouth. First of all, that baby video, that baby was so sweet. And you're doing
Right.
all these things. And I was just gushing in here with everybody. I'm like, I can't wait. This is so cute. I was just losing my mind because the baby was just adorable as you were in
love
their
that.
mouth.
And sometimes they're not that way. Sometimes they're real angry I'm in there.
I was shocked. I was like, what a special little child.
That baby was such a sweet soul. I mean, when I meet them, my favorite part of my job, truthfully, is when I meet a baby, I'll hold them and I just we make this eye contact and I swear they speak into my soul. And I do a visual assessment, but just like staring at them and just almost asking permission I want them to have consent too. They're little. They've come into this world and just been turned upside down. But when I lock eyes with that baby, it's such a special moment of just like, okay, tell me what you need. And then, asking them and kind of listening to their cues. And then when I'm assessing the suck, so that baby specifically, I've known that family for a while. And when that little one came around, I was like, you are letting me do all sorts of things and just a strong little warrior. And that was actually super impressive because it was post frenectomy, which is how you treat tongue ties. And so I was demonstrating the stretches to keep that area, supple and heal correctly. And he just kind of let me do whatever I needed to do.
I was so moved. I really was. I was so moved by that baby. I was like, oh my God.
He's a special little guy.
I don't get like that all the time, but I was, losing my mind. So what is tying? And then of course you'll tell us about frenectomies because that doesn't sound great.
So a oral tether. So everybody has frenulums. That's the stringy part under our tongues.
Oh.
Okay. So, and we also have a lip frenulum, which is what connects our lip to our gums. And then of course our tongue to our jaw. However, if it is connected in the wrong spot, it can cause a heap of issues. So this ligament is a collagenous fiber and it goes all the way down to the toe. So if you were to actually look at a cadaver and see that ligament, it literally connects from here and controls everything within that midline down to the toe. One ligament.
So the one that connects our mouth here and underneath here, how is it one? It goes behind the throat?
It actually does. It kind of loops behind and it can go all the way down. It affects our gut. It affects your back. I had my tie corrected at age 40. For chronic migraines. Had no idea this whole time. Went through the same process. My kids were 16, and that's a whole amazing story in itself. My eldest was 19 when she had hers, and we just did her boyfriend at 20, which was a fascinating case.
And that's a frenectomy.
A frenectomy, when you treat lip and tongue ties. So as a baby, the reason why we look is that it is linked to lifelong health issues. So in the beginning stages, I mean, we can tell from day one, right? The minute they're out, whether or not this is going to be an issue. And there's different types of ties. So an anterior tongue tie is when it's to the very tip of the tongue. Those are very obvious. That's what pediatricians are trained to look for. They don't really know to feel, but those are the ones that they'll be like, yep, I see it. Back in the day, they would use scissors to clip it, which exactly, hot, bloody mess.
Whoa.
It kind of fixed the problem, but it wasn't giving the results that they were hoping for, which is why ties and frenectomies get a bad rap. We now have the technology with a CO2 laser to treat it through a frenectomy, which I'll explain.
Okay.
But in the meantime, so what's causing this ligament can be genetic. It's a dominant gene. We're starting to see an increase due to epigenetic changes from the 80s. That is just, it's not that ties are new. They've been around since people have been around. It's just a newer discovery. So what's happening with this is that if you have a posterior tongue tie, that's when that stringy part or that frenulum grows into the tongue. And so you'll see babies with sucking blisters. They'll have a white coating on their tongue. So they click when they feed either from a bottle or the breast. It can, from a breastfeeding standpoint, it can cause low supply, painful nipples, which breastfeeding shouldn't hurt, but it often does. And that's one thing I try to explain to moms is that it shouldn't hurt. So if there is something needs to be adjusted, there's always a reason. There's always a reason for sore nipples, always a reason for low supply. But even for my pumping moms or my formula feeding moms, ties can cause colic, which is undiagnosed crying of 3 to 4 hours. So really, babies don't cry to cry. There's always a reason.
Yeah.
So if they're crying, it's usually they're in pain or they're trying to communicate something. So these babies who have a tie, whether it's a lip tie or a tongue tie, it can actually cause gas, reflux. And because it can't stretch, as the baby grows, it can cause more difficulty. So the first 3 months of that baby's life, that suck is a reflex.
Well, I could imagine it would get sore.
Absolutely.
If you're sucking and it's not in that right place. Like I just felt it back here, just thinking about it.
Absolutely. It takes, for one suck, there are 12 cranial nerves, 40 muscles, and then the 7 bony plates in the infant's head. So if there's any tethering along that line, it's pulling that back. So babies are biologically meant to feed laying on top of the mom, which is why pregnant women get the dark line on their bellies, why their areolas get darker, because when the baby's born, this is literally the treasure map that leads to the target where the baked brownies are at the restaurant, right?
Wow.
It's instinctual. So with even our bottle-fed babies, I encourage certain paste feeding positions because it's going to associate those muscles and prevent any tension or colic if they're fed in a specific way, because babies don't necessarily have control of a suck or their pattern if they're on their back. So we teach a different position for bottle feeding.
If they have this tongue thing.
Correct. Right.
Got it.
In general, really. I mean, babies' instincts to eat, they should be paste feed regardless because it's going to just control how much gas and they're in control of their food in that way.
Meaning feeding them upright.
Correct. Either upright where the bottle is horizontal, or I will use acupressure points, which along the babies, and that's in some of the videos I have, on their shoulders and then on their bottom between their tailbone and their anus is actually the most calming point in the entire body. So that's why moms instinctually pat a baby's bottom, is because that is in acupuncture is called the DU2, and it actually reboots the nervous system. So for a baby, if there is pressure on their shoulders and their butt, during feeding, during calming, it actually reboots their nervous system and releases the cerebral spinal fluid that just immediately calms their nervous system and it simmers them down.
So you could actually, that's interesting because John Amaral, who's been on the show many times, he's an energy healer. Whenever he works on me, he's touching my tailbone.
That's right. It is the hub of our nervous system.
Wow.
Yeah.
So
and it's
that's
very
interesting
prevalent.
to know with your baby. I do it with my dog.
Yeah.
And he instantly he loves it.
Yes.
I mean, I'm not putting it down there. I'm putting it on top, like right at his tail.
It's for any mammal. It just happens to be the hub of the nervous system. And as mothers, we just instinctually kind of pat their little bottoms and it will calm them. So if you have a baby that has a tie where this is all restricted, they're going to try to protect their gut, right? And as they grow, it can cause issues with picky eating, poor sleeping. You'll hear about children who in my daughter's case, she was put under anesthesia 4 times before the age of 6.
Oh.
And my mom was screaming. I'm like, something's not right here. She's different than her sister. And I was being dismissed by doctors. I mean, she had enlarged adenoids. You'll hear about kids getting tubes in their ears from frequent ear infections, their jaw being recessed, palate expanders, orthodontics. You think about, sleep apnea, how many adults are walking around with CPAP machines, or how many of us have had braces or gaps in the teeth. So a lip tie will cause a gap in the teeth, and it actually affects the sinuses, which is what's going to cause some clogged tear ducts in infants, but as they grow, this can't. So it causes lifelong issues and pain.
Probably a lot of sinus infections.
Absolutely. Sinus infections, ear infections, because the eustachian tubes in an infant are sideways. And so as they're growing, if they have a tie that's not been dealt with, those tubes can't drain. So that's why they'll put tubes in the ears to keep the eustachian tubes open if these kids are getting frequent ear infections. So what we had figured out is a new way to treat this. And if we can diagnose it young and treat it young, it prevents all of that.
Wow.
Yes.
And migraines.
And migraines.
Do you feel like a lot of people who are walking around with migraines probably have this and didn't realize?
In my opinion, yes. I think there's no statistics to truly support that. In what I see, in my opinion and observations, I do believe that it's probably a higher case. And certainly, just looking around it, for me, I went in with a 10-day migraine. I had TMJ pain, wasn't expecting, my daughter was going to be getting the frenectomy, but being a mom, I was like, pick me. I'm going to do it first. I want to know what she's going to go through. And I walked into the doctor who actually does our releases in our clinic. And I was like, I don't care what you do. Like, I just can't function. And it takes 3 seconds. It's a CO2 laser. It vaporizes the tissue and releases it and cauterizes it. It's super fast.
Wow.
And what was interesting is I wasn't we numb the area so you don't feel it, but I heard it release. Like, I heard it pop audibly, which isn't usually the case. And my headache was instantly gone.
Wow.
I felt like my head was floating.
But you found this at 40.
Yes.
Did you not know you had tongue tie situation?
No, I didn't.
So it's not something that's super obvious for people. Because to me, the way you described it sounded obvious. Like, that little thing under there,
Yep.
if it's too far forward, you have it.
Correct.
But probably in the other places, it's harder to detect.
Exactly. So if you have a posterior tongue tie, the string that you can see is in the tongue. So when a baby...
And it connects back here.
Correct.
So you wouldn't see that.
You wouldn't see that. And so it affects the placement of the jaw. You think about individuals that grind their teeth or have TMJ pain, right? And so what ends up happening is that this just ends up cementing and your body's going to grow extra ties. So in my daughter's boyfriend's case, where we have, because in our clinic, we have a chiropractor, we have a speech language pathologist, we have a dentist, and then of course myself. And so we did an experiment where we had the chiropractor kind of palpate his back. He's 6'5", like he's a big guy, but woke up with a headache every day of his life, has ADHD, which ties have been linked to the increase in ADHD because if you have a tongue tie, the tongue grows sideways and it blocks the airway, which is why if you ever see a child breathing through their mouth, that's a red flag. Babies are obligatory nose breathers. So if they're breathing through their mouth, that's a huge red flag that something isn't right. And so that can cause a blockage within the airway. And if they don't get into a deep REM sleep, they don't grow. They can, and if there's not good oxygenation to the cortex of their brain, then they can develop ADHD, which is what has been the newest link, which has been fascinating.
Wow.
So in Ethan's case, we decided, you know what, you're an adult. You can talk to us. The babies can't. Tell us what you're feeling. And we filmed the whole thing. And we were Dr. Weaver came in, who's our chiropractor, and was, feeling his back and his spine during the procedure as we released his ties. And she felt it melt like butter. But what was so fascinating is he came off literally, you're in the laser room 5 minutes. And a lot of that's just prep work. He came off the table. His whole face had looked different. Everything had relaxed. And he looked super out of it and almost looked like stoned. And I was like, dude, did you take something? Like, I'm not mad, just tell me. And he's like, no, I don't know. I feel like euphoric. And what had happened is he had an oxygen high because for the first time in his life, he had full oxygen.
I have the chills.
Yeah.
So how do you diagnose this? Is there an MRI to be able to see that string?
All I have to do is do an exam in the mouth. So I can tell by lifting up the lip. I can tell by, in an infant, I just feel their suck. If a baby is using their jaw to lift the tongue in order to curl that tongue around a bottle or their finger or their pacifier, I'm a big fan of pacifiers. I'm probably rare in my field to say that, but it does do a huge service for strengthening the lateral side of the tongue, which is so crucial for this process and the healing process because babies have to chew to poo. So the pressure point is in the roof of their mouth for a baby in order to digest. So if you have a tied baby where that tongue is tied to the floor of their mouth, they cannot lift the tongue to the roof of their mouth to clean itself. So that's why you'll see milk protein on the tongue, which is another red flag. That baby's going to be gassy because they can't create a seal around the breast or the bottle. And they can't lift their tongue to the pressure point in the roof of their mouth to cause the peristalsis of the colon to digest. So these babies are constantly asking for something in their mouth, which parents then, okay, you must be hungry. We overfeed. And it causes this vicious cycle of reflux and gas. And the babies are just trying to chew to poo.
Wow.
Yes.
Okay, so if I was putting myself in this situation where I'm like, okay, I think I have a baby with this. All right. If there is no MRI to show you exactly what's happening, how do you identify the location properly with a laser? Like, does this ever go wrong for people?
The beautiful thing with the CO2 laser technology is that we have a dentist because they're doctors of the mouth. And by lifting up the tongue, we can see exactly where it connects. So the best way for me to explain it, which is why you don't need really any imaging, think about a snag in your sweater, right? Everything kind of bunches up. If you release that string, the material will open up. It might be a little bunched, but it will open up. That's exactly what's happening if that frenulum is in the wrong place and it's tied. So when we release the lip and the tongue, because 95% of the time, if there's a lip tie, there is some form of a tongue tie. And if you just lift the lip up, you can see instantly in a baby whether or not they have a lip tie, as well as an adult. And a lot of the advice from pediatricians is, don't worry, they're going to learn to walk and face plant and they're just going to break it on their own, which is terrible medical advice. Like, why are we waiting for this child to fall and an ER visit? And now we have, this bloody mess and a trauma to this child, which was traumatic when we could have identified it, allowed it to heal properly, address it correctly, and treat it within 3 seconds. So when we treat it, we numb it with a topical gel. We literally just use so the CO2 vaporizes the tissue and it cauterizes it so it can't necessarily reattach. If you do proper care of massaging and body work along with it, it allows the body to heal a little slower. So it will form a new frenulum, but in the correct spot. So that way their whole body can open up and we can put them more in extension instead of flexion, so that way they're not causing more defects.
But there's also the one you said that you can't see that goes through the tongue.
Right.
So are you saying that that's the only one that's not visible and the other ones would be visible? That would be the indicators that this is something you need to deal with?
Correct. And the posterior, which is the one you feel versus see, so a lot of times the tongue will curl in. So there are things visible that you can kind of decipher that give clues to go and feel the suck.
Okay.
But there also can be a submucosal posterior, which is where there's a piece of fascia. So babies are covered in fascia, which is like press and seal cling wrap, right? Over their muscles, their bones. And so if that frenulum has grown into the tongue and now this piece of fascia is pushing it back, when you lift the tongue up, it'll look very white and sheen. So those get missed all the time because unless you're feeling that baby suck and feeling where that tongue can curl, and if they can't lift, then we know there's different therapies that should be done prior. So sometimes we can get the tongue functional enough where we don't have to do anything. Other times we need them to see like a speech language pathologist or feeding therapist first. Other times we just have to intervene because they'll never be able to suck if we don't.
And is this something that you do on really young babies, the frenectomies?
Absolutely. Wow. Yeah. I mean, I think.
Is there a birth age that is not possible to do it at?
Nope. We've done it on a 1-day-old, and it can be done. And truthfully, if the baby has an anterior tie, which is where it's to the tip, they cannot stick. They won't be able to eat if we don't treat it. And so this.
Will you come see my baby?
Absolutely, I'd love to.
And let me know.
Of course.
I'm like, oh my gosh, I would never have even known about this.
A lot of people don't, and that's where kind of our mission at Tongue Tie Tribe is to address it more holistically. That's why I wrote the book about it, The Movie Fairy's Guide to Breastfeeding. We really try to create and get the education out there because it's not being talked about. It's not being taught to physicians. And so it's really fallen on the parents' laps to do their own advocacy for their children. And that's a lot to carry.
Yeah. Well, I think when you're already having to do so much, you just gave birth, you're now trying to care for a baby for the first time and figuring it all out. I'm in the beginning stages of, holy shit, there's a baby coming and I need to learn a lot. It was great because the pediatrician was like, you don't need to know everything right away. You're okay.
That's true.
Okay, thanks. Because I was getting a little nervous that I don't know anything. But, there are things like this that, we would never hear about.
That's okay. I'll come be your baby fairy.
Okay, perfect. I know we haven't talked about the lactation in specifics, but is there anything else with tongue tying that we didn't get to that this affects? Does it affect, do babies get jaundice because of this? Obviously, we talked about them getting colicky because of this. Is there anything else?
In the infant, it definitely does not cause jaundice. That's a completely separate condition.
Okay.
I will say if the baby does have jaundice and has a tie, it makes it more difficult to treat the jaundice because the only way to get rid of jaundice is for them to be able to eat and poop, right? And so if your tongue isn't functioning and you're burning more calories than you're taking in, that's a problem.
Yeah.
Because the only way to treat jaundice is to literally intake food. So if your mouth isn't functioning properly, you can't take in the food to be able to treat that. But those are two totally separate conditions. One thing I do try to educate families on, because obviously we have this brand new baby. We don't want to have to do a procedure to them if we don't have to, but really advocating that this is your little one. So trust your gut on when and how to do this, but also knowing it's going to affect them. It can affect them lifelong, their speech, their quality of life, their eating, your bond with your child as well. But it is something that, we are seeing more of. And so really just getting the education out there and knowing, is this a possibility? You may be the one to first see it from breastfeeding or just a gassy baby.
Yeah. Or even, like I said, in an adult, for an adult now to walking around with ADHD or migraines or any sinus infections or any of these things, to know that there's one other thing out there that they could be looking at.
Absolutely.
That could be cured really quickly with a little laser. That's fascinating. I mean, Kelsey, I know you deal with sinus infections, so I'm sure that kind of.
Oh, I'm literally sitting in here going, Paria, can she look at my mouth after? Yes.
Wait, do we have gloves? Let's have her examine you here.
I mean, seriously, I get sinus infections chronic. I have my whole life. And actually, my sister, she's a singer, so she found out that she had a tongue tie through her vocal coach. So I'm like, wait, actually, that's a good question.
Yeah.
Can it be genetic?
That's what I was going to say.
It is absolutely. It's a dominant gene.
Oh.
It's basically all over the family, rampant.
We have to find gloves. I know we have them in the house.
We're going to do
when we're done with the show. We're going to do for social. We'll do little videos and I'll get checked.
Yeah.
I love it.
I don't think I have it, but at the same time, it'll be a fun video.
Yeah.
I had a holistic doctor that would do all this mouth work, and it was very painful, like in rubbing jaws in the, because I would have such bad TMJ. Now I understand it was from the brain tumor that was pushing on that nerve that controls the whole side of my face. And through meditation, I've healed all of it.
I love that.
But it was that mouth work. Every time she's like, do you want me to go in your mouth? I'm like, nope. We're good.
I'm busy that day.
Yeah. We'll just stick to the acupuncture and the Reiki and stuff. We're good there. But this
love acupuncture.
This mouth work did not look painful. So what do you do? Because I saw in your video with that little boy, you were massaging and doing all this stuff. So is that in place of a frenectomy, or is that something you have to consistently do after a frenectomy?
So what you were seeing in that specific video was the aftercare instructions for right after. So he had just had his procedure, and immediately after, we bring you in where the mom either breastfeeds or bottle feeds, whichever she's choosing to do. And then I teach the parents the aftercare stretches. So those are the stretches that we have the parents do every 4 hours round the clock for about 2 weeks.
Wow.
And the point of that is to keep the space open so it doesn't heal too quickly.
And that it heals it in the right spot.
In the right spot. And it's not pleasant. I mean, we're very open about it. It doesn't feel great. They're not going to be thrilled you're in your mouth. Or you're in
unless you have that special little boy.
He was a special spirit, let me tell you. Some babies kind of look at me like, what in the what, lady, are you doing in my mouth? But a lot of the times, and then they're over it. Like once you're out of their mouth, they're fine, And I can tell you from when I had it done, it feels like a deep tissue massage. Like if you did 50 squats and then the next day you get up and you're like, oh my stars, my thighs are on fire. I mean, it's that type of massage, which for a baby, they're like, get out of my mouth, lady. This isn't pleasant, but it's a hurts so good type of feeling, but it is so important. And the babies will cry. And we just tell the parents, my daughter, when she had hers done, looked at me, she goes, Mom, I get it. As a mom, you have to do hard things to make me feel better. I might say a 4-letter word. Don't get mad at me. And I was like, fair point. And so it's sore, but the relief you feel afterwards is stupendous.
How long is each session?
It's seconds.
Okay, so you're just going in there quick.
It's literally like a big giant scoop under the tongue, and then the upper lip is a rub, and that's it.
This sounds like the job for the baby nurse.
Yes, absolutely.
I'm just laughing because I would want to do it, but I'm saying if I look back at life, there was a moment with our dogs. When we first got our dogs, 2 of them. One of them didn't want the leash. The second I put the leash on this dog, it was a car alarm. And he would go ballistic.
Yeah.
This is Benjamin, by the way. Did you meet Benjamin, Kelsey? Oh my God, my little chubby bubby. He hated the leash. And we had this really wonderful family that lived below us in the apartment complex. And we went away one weekend and we said, you guys, get him leash trained.
Nice.
You put the leash on him, you figure it out. And when we came home, he was really good with the leash. And I didn't have to go through the pain or the trauma.
That's the way to do it. You be the rescuer. We'll be the bad guys.
Yeah.
We're all right with that.
So funny. Okay, so lactation. You're obviously an expert on lactation. What do we need to know about lactation?
So breast milk, of course, is a living fluid. And one thing there's so much pressure on moms to breastfeed. And this might sound odd coming from a lactation expert, but I truly stand by, because I was that mom who struggled, is that there is, of course, the Fed is Best campaign. And I just feel like there's such this divide when we're just trying to care for our babies of, do we breastfeed? Do we bottle feed? And it doesn't have to be black and white. It can be both. It's really whatever is going to give you that bond with your child, truthfully. So breastfeeding, yes, scientifically we know is best. In 1 teaspoon of breast milk, there are 3 million germ-fighting cells. It is a living fluid. And what's great about our breast is that it's constantly changing. So for example, when the baby latches onto the breast, that saliva absorbs into the mother's breast and it can react to whatever that baby is fighting, if there's different nutritional needs, etc. But that doesn't mean that has to happen, right? So breast milk is constantly evolving based on, it can change colors, it can change consistency, it will change volumes throughout the day. So in the morning, you'll have larger volumes, and in the afternoon and evening, you'll have less, but it's exactly the same calories.
Oh.
The way I kind of explain it, this is the restaurant, right? So the supply truck comes at 3 a.m. with all the ingredients you need for the day. So in the morning, you have an omelet bar. So mom might make, say, 3 ounces. Lunch rush happens. Afternoon, you got an egg left in the kitchen. But the baby's the chef and the lactating mother is the kitchen. So when the chef comes, they can make something. So the milk's made instantly the minute you pump, the minute they suck, regardless. And so it is all made the same consistency. And so based on whatever the baby needs at that time, it can change. But what I also stress to moms is take the pressure off your shoulders, because you only need 1 to 2 ounces of breast milk in general, doesn't even have to be specific to that mother or baby, to really give them the full benefits. And even if it's 1 day of receiving breast milk or 2 years of receiving breast milk, that baby's still going to be benefited. And so truly, when you're looking at the mother-baby dyad, it truly depends on, number 1, we feed a baby, whether it's breast, bottle, formula, it does not matter. We have many ways to feed our baby. And number 2, you have to do what is going to make you the best mom for that baby. And if breastfeeding isn't for you, that's okay. It's okay. You have to do what's going to bond you to that baby. And that is the most important facet of motherhood, period.
I just laugh because I see my husband, Kevin, was a formula baby.
Okay.
I was a breast milk baby. When I look at the two of our health, it is completely opposite.
Yes.
He is so healthy. He can totally abuse his body and do all the wrong things. I mean, not like all the wrong things, but I mean, just like eat super unhealthy, not sleep well, all those things. and he's an ox. And I have to deal with all these health things.
Girl, I feel you. I have all the health issues in the world, and I look at the same situation.
Right?
Yeah.
So I am not afraid as a mom to be of formula. My question is, are you able to interchange them as needed, like from go?
Absolutely.
So it's not a problem.
It's not a problem. Let me preface it with this. Some babies are very sensitive. Their guts can be very sensitive to certain proteins, which is where it gets tricky in the sense of I've seen time and time again if the baby is gassy, for example. I mean, I get sent poop pictures all day long because I'm always being asked to decipher, what does this mean? Is this mean okay? My husband's terrified of my phone because it's usually breasts or poop coming into my phone. And so you can tell a lot from what's coming out. Based on the color, are they having a difficult time digesting bovine protein or cow protein or soy protein? Do they need goat's milk, etc.? Or if the lactating mother is ingesting certain things, is there issues? Is the baby going to react to that? And for example, in one of my videos, you'll see me talk about dairy hair, right? Where the baby's hair can stick straight up, and that can be an indication that the baby can't digest cow protein. So they manifest it in that way. And so that comes the game of, do we have to be specific at what we're giving the baby, right? But in most cases, absolutely you can do both, and there's not usually an issue.
How do you break down the poop? I want to know, colors-wise, what everything kind of means.
If you walk in my office, there is literally, I have paint sample chips of all the different colors of poop within the first, 6 days of a baby's life. So I usually walk in, I'm like, all right, what color is your baby's poop? Is it, duckbill orange today, or is it seafoam green? Based on the paint. The guy at Lowe's looked at me like I was painting something. Let me tell you, when I made the chart. But in the first 48 hours, so this is actually good for you to know, the poop is going to be very black and sticky like tar.
Ooh.
So
Scary.
that's meconium. And the baby's gut is actually open. So when the baby ingests colostrum, which is that first milk, which is full of rich antibodies, it's thick like honey. That's why we call it liquid gold. It actually goes and fills the gaps of the gut. It closes it and it pushes out that meconium.
Oh, wow.
So it's very black and sticky. So always prep your husband for that, because it freaks dads out because it's very sticky.
So that's good.
That's a good thing.
Okay.
Right. And then around day 2 or 3, it should start to transition into more of a green color. And then by day 6, it should be yellow and mustard seeds and, like bright yellow. And that's healthy poop. I want to see it yellow and seedy and it usually doesn't have an odor, which is great. Helps with that. And so that's what I want to see. If it's breast milk poop, if you are doing formula based on whatever protein of that formula, it can change the consistency of the poop. So if, for example, there's more soy, or if the baby's having a difficult time digesting the cow protein, it can look more green or mucousy or have some blood in it. And those are red flags to look for. But if it's a pasty consistency, some formulas can represent that. So that's where, if they're getting both breast milk and formula, you'll see the interchanging of the colors. And that's why I get sent pictures.
That would be so confusing then, to know what's what. And also, that would be really confusing, I would think.
And as a first-time mom, you're looking at, you're going to have more conversations about poop than you ever thought possible. You're going to
I've been doing it for 20 years with the dogs. All I do is stare at their poop.
Right?
I look at every poop. That's how I know when they're healthy. That's when I know they've got digestive issues. I see the mucus. I see the diarrhea. So we've been poop people for a long time, because those have been my babies.
Yeah.
Now,
So you get it. Yeah. You're going to be analyzing. And that's why I get sent poop pictures on the daily. Is this normal? Is it supposed to look like this?
So how do you know, with formula, where do you even start with what's the right formula? Because that sounds really difficult. I mean, as adults, I feel like here on this show, all we do is talk about, like, okay, we finally found an almond milk that doesn't have xanthan gum, that doesn't have all these additive things. I can't imagine and I'm just starting on this journey, I can't imagine, how do I find something that is formula, that's in a bottle, that's going to be the healthiest, safest thing for my baby?
That's right. It can be very tricky, and finding the right bottle for your baby's mouth, which is also a whole nother ball game.
Oh, wow.
Yes, I can walk you through that. That's okay.
Okay.
I do recommend, like you want an even flow, you want to match the palate of the baby, right? So they don't, some of the wider mouth bottles, it's harder, especially if they're tied, for their lips to flange and then they suck in air. So
they get
gassy, right? And then that's just uncomfortable. So more of like the even flow balance bottles or the Lancino bottles that kind of slope a little bit, that can naturally accommodate a baby's mouth and allow them to use, their tongue versus their cheeks or their lips to suck, so they don't burn more calories than they're taking in. A lot of times, if it's the wrong shape or if they're tight, it's like sucking a milkshake through a straw with a hole in it while running on a treadmill.
It's the worst.
Right? And then these babies aren't gaining weight, and then the pediatricians are concerned, and then these poor moms feel like it's their fault, when in reality, it's the baby's just eating on a treadmill. So we take the treadmill away, or we change how they're being fed and what position, makes all the difference in the world. So with formula, I do recommend a lot of, I love more the German formulas like Whole and Hip, a lot of the more organic side of it, because they don't have corn syrup in it.
They put corn syrup.
Most of the name brand formulas, their number one ingredient is corn syrup. Exactly. That's the face I made when I learned about formulas. So the Similacs, the Enfamils, the Gerber Good Start, their number one ingredient is corn syrup, and that's wrecking these kids' guts. And we know, I'm sure you know, based on your reaction, how detrimental that is. And so
I just know syrup and corn. Like what more do you need to know?
Right.
Like that's just not.
And that's how we're starting.
There's no syrup in a breast.
That's right. And we're starting these kids off with that as their fundamental in their gut health. And that's a problem. So if there's a mom that's doing both breast and formula, really, I try to steer them away from the corn syrup options, obviously. So a lot of the European German formulas they're goat milk based. They're healthier. They don't have any real additives to it. It has the appropriate,
Well, goats can't be fed hormones because they die, right?
That's right.
Goats and lambs. I
believe so.
Yeah, lambs, that's why you can have lamb meat technically, and it's safe because they can't be fed hormones. We need to make sure we write the list of these formulas down as a resource, not only for social, but in the summary of this episode. So everything that she's mentioning, guys, we will put in the summary of this episode. And if you're watching on YouTube and you have any questions, pop those down in the comments, and we will try to get those answers to you guys.
Absolutely.
So German formulas.
Mm-hmm. There are some, I will say, some of the more, there are a couple American brands like Kendamil and Bobby that have really done a great job of trying to stay away from that as well.
Oh, I think I've heard about Bobby.
Yes.
I think my friends work with Bobby, and they were saying that I should use that.
They're a great company.
Okay.
It's funny, some of the practitioners in our office, we sit around and we talk about all the formulas and we break it down. And, like our speech language pathologist, who really focuses on the gut more than any of us, she will break down the components. And there's certain, she's more obviously Whole Hip, which are the European, she likes, certain attributes of Kendamil. And then there's Bobby, which has different fat and protein ratios. I personally really do like Bobby. I feel like the way they've done a beautiful job in making it accessible, especially when we had the formula shortage, which was so stressful on families. They did a beautiful job they're just moms who created this formula, and they make it so beautiful to be able to give to the families that need it. So they are one of my faves for sure.
Good to know. Good to know. Let me see here. I want to make sure I'm not missing anything here. Pitocin. So I'd love to know more about that, because the surrogate reached out to me and said that the OB wanted to schedule an induction and to induce. And I was like, whoa, wait, why are we inducing? Why aren't we just letting the baby come when the baby wants to come? And I am pretty knowledgeable, having seen Ricky Lake's documentary,
Fascinating,
The
right?
Business of Being Born. And I was like, oh yeah, this is about the business of being born
Absolutely.
and schedules and all of that. And so the surrogate, I love her so much. She had her babies went past term.
Okay.
And so I think with her second child, she induced at some point because she couldn't take it anymore. But I said to her, I don't think we want to do that. And then my friend who's a doula, Lori Bregman, who's been on the show many times, was like, you don't want to do Pitocin because a lot of babies have bad side effects from it. So will you educate us all on Pitocin?
Absolutely. So I actually have a background as a doula. That was my first job in the childbearing field. So I've seen it on both ends and can completely relate. So Pitocin is a synthetic form of oxytocin. So oxytocin is our love hormone. It's what's released when you have an orgasm. It's what's released when you are lactating. And it's also what starts contractions. So Pitocin is the synthetic form of oxytocin. So depending on that mother and her anatomy and her past birth experiences, which is really beneficial because she knows how she births, she knows what her labors are going to be like. And the reason why you start to see practitioners wanting to induce when they get to that 42-week marker is because the placenta, which is the organ, of course, that supports the baby, can get old and it can calcify, and then the nutrients aren't as good to the baby. So it can actually become problematic if the pregnancy goes on too long. In those instances, besides the fact that the pregnancy, the mother is ready to be done. I mean, I was that mom, like, get her out. There are natural ways to induce if the baby's ready, right? Yeah. So it really should be on the baby's time. When the baby's ready, she or he will come. Mm-hmm. Certainly there's acupuncture that can help not only for inductions, also with breastfeeding, calming. That's also part of my world. But the problem that we're seeing, and Ricky Lake's documentary shone a huge light onto that, is that Pitocin can cause extra pressure on a baby's head. I think it's been documented to be about 7 times the amount of pressure on a baby's head. So what we see in our clinic is these babies come in. I will, of course, the first thing I ever do after gazing into that sweet one's eyes is I check their suck. I can tell instantly from the way that baby's sucking if they've had Pitocin, because they suck almost defensively. It's like this fight or flight, because remember, they have those 7 bony plates which mold together to fit through the birth canal. And so that's why sometimes babies come out with cone heads. However, when the uterus is responding to oxytocin, our body's natural hormone, and the prolactin, and prolactin's a lactation hormone. But when you're responding to the oxytocin, your uterus contracts this way for a contraction, and then it contracts the opposite way for the next contraction. If you're releasing oxytocin while they're synthetically giving you Pitocin, now you have both strengths going against this baby.
At the same time. That's why it's putting pressure on the head.
Correct. So the goal is to push the baby down and put pressure on the cervix so that it dilates and opens faster. But what they're not taking into consideration is the trauma that's doing to the baby as well. So they're entering in with extra force, constantly being hit, right? So it's almost like the uterus is doing this. It's getting both motions, and so it can stress the baby. Sometimes they'll pass their meconium in the uterus, which can be harmful, or they'll end up stressed. You'll start to see, we have a saying in the birth world that one intervention leads to another intervention, which can lead to a cesarean. And so if that Pitocin is on too strong and stronger than it needs to be, and the uterus can't handle it, then you've got issues posed to the baby's cardiac health. Are they getting stressed? Is the uterus getting tired? How long are we having this? What strength do we have it at? It can be a good tool when it's necessary, but it doesn't need to be skyrocketed out. So when I see a baby come in and I'm feeling them, they are so tight and in pain. A lot of times the jaw's misaligned. And so we have to call in Dr. Weaver, who's our chiropractor, to be able to realign the jaw because it's just put so much pressure that then they can't suck correctly and they're whimpering, it hurts. Oh. So we try to avoid that if we can. If it's a necessary tool that this mother and this baby needed it because they needed to be born, then we have the resources to undo some of that. So that's why body work, cranial sacral therapy, chiropractic care is so important, in my opinion, after a delivery to kind of undo what that extra force has done. It's because, like I said earlier, babies are very rubbery. Their bones are rubbery. They have fascia everywhere. So we just kind of undo through stretches. And I make it a strong point to teach the parents these very simple stretches they can do at home to help undo a lot of the tension that the birth process went through if they had Pitocin, even if they just had a fast delivery and came out faster than they were ready to. That can happen, especially if it's the third baby or fourth baby.
That's funny. The surrogate delivered the last baby in 4 hours.
Okay, so be ready to catch.
Yeah, I know. Well, that's why we have to be on baby watch.
Yes. Yeah, especially if is this her fourth pregnancy?
This will be third, yeah.
Yeah. So we call that a multip. So yeah, that baby could come real fast.
And my child is very active in the womb right now.
I love that.
Very active.
They make awesome humans.
Yeah. So I'm like, I wish my mom was around. I could ask her how active I was, because I just feel like this child is going to be very, very like me. Because I was like, get out of my way. I want to get going. I walked at 8 months. I was like, let's go.
That's amazing.
Yeah.
I love that. Was my daughter. I mean, I was on bed rest with her for weeks, and I remember literally watching her stick her hand out and move across my belly, and it would freak me out. But she's still that feisty of an adult afterwards.
So funny. Well, they say an active baby is a healthy baby.
Absolutely.
Right? So, because at first I was so nervous, and then I started looking it up. I'm like, okay,
it's a good thing.
It's a
very good thing.
I love knowing that there are ways to undo this. Again, things I never would have known. If you weren't educating us on this. And I love understanding what the Pitocin really does. So understanding the contractions this way and then this way.
Yes.
That makes me understand what this medication is really doing. I did say, if we have to, obviously, if we're in situations, where we have to do things, we have to do things. Like, I'm not going to be unreasonable. You said you had to do it. So can you share that experience?
Yes. So with my first daughter, I was young. I was 22 and I have lupus. So my body is kind of a hot mess, expressed sometimes.
Okay.
And I went into labor early at 27 weeks, was on bed rest for, until about 37 weeks. And then I started preterm labor contractions again, but it went on and it went on for weeks. And I was getting tired. She was getting tired. And so at that point, it was a necessary tool because my body just wasn't sure what to do. And I also have a condition called Ehlers-Danlos syndrome and POTS. So my body metabolizes medications and things very quickly. So I respond differently than the average human. And so my body needed that help in order to get going. So in that case, I had tried everything. And so
also, if you're not moving, contractions are a lot harder.
Exactly.
Because I know from my friend who's a doula, she takes people on walks and hikes to get them to start dilating.
Right. And the difference too is when you're releasing oxytocin, your natural hormone, you're also releasing endorphins, which is our body's natural painkiller. So you have something to cushion the blow because your body's the one doing it. So when you're in labor on your own, your body's giving you that break. It's giving you the endorphins to deal with the pain of labor. If we're synthetically giving you something that's going to increase your labor, your body isn't quite aware of that. So it's trying to play catch up with releasing these endorphins. So contractions are completely different. They feel different. They're more intense. For me, it was too much. I mean, I had wanted this, natural. I was a doula. I wanted it to be, and I ended up with an epidural. Of course, my body is weird, so it only halfway numbed, but that's a different story. But I was, stuck, and then she was born, and it ended up being beautiful. But 21 months later, when I was getting ready to give birth to baby number 2, I absolutely was adamant. I do not want Pitocin. And, I've learned in the many families I've walked through this process with, our mind is very powerful. And oftentimes, if there is a preterm labor situation or prodromal labor, which is where you're contracting for hours and days and it just keeps going on, usually there's a mental block. And so it's important to kind of acknowledge that and talk through it with the birthing mother. So in my case, I wasn't even making the connection that there was just a block there that I needed to work through. And
because you were so adamant you wanted it one way.
Exactly. I wasn't being flexible. And at that point, I was stuck at 3 centimeters for 16 hours. And finally, my doctor, who's a dear friend of mine, kind of like, Danielle, we need to have a little chat here. Like, you've hit your thing. Either get the epidural or allow me to give you Pitocin. I'm like, I'm not doing it. I'm not giving Pit. Because the contractions were so much more intense. And I was terrified of that, truthfully.
Well, because now you're going to have it double.
Yes. And I was like, no, I don't want that. And it's funny, the power of mind. I agree. I got the epidural, which worked that time, thank God. And the doctor came in. She goes, I think we maybe need to mix that bag of Pit. And it's like my brain said, absolutely not. I went from 3 centimeters to a baby in my arms in 30 minutes.
No way.
Yeah, power of mind. I was like, I'm not doing that, and my body just let go. So. Wow. It's power of mind.
So do you see a difference in your 2 daughters, Pit and no Pit?
Interesting.
Have you ever thought of it?
I haven't thought about that.
No way.
They both...
Does one have more trauma than the other? Does one have more health issues than the other? That's what I would want to know.
They both have a lot of health issues.
They do.
Unfortunately.
Wow.
Weird ones.
I'm
not
sorry.
The most... That's okay. It's given them strength. It really taught me a lot as a mom of having to be an advocate for your child. Like my eldest daughter, when I was talking about Grey's Anatomy, for example, she had a condition called MALS, which is median arcuate ligament syndrome. So basically, she lost 30 pounds in 3 weeks. She couldn't eat without being doubled over in pain. And we were going to doctors.
At what age?
17.
Okay.
Yeah. And she was tiny, and she actually went on a missions trip with her dad to India. And so they had taken the typhoid vaccine, and it's an oral vaccine, and that's the way to travel. And what had happened is when she went through puberty and her breasts, had put pressure on her diaphragm. So what MALS is her diaphragm sat 3 centimeters too low and cut off her celiac plexus artery. So she had 10% blood flow to her digestive tract. And so it had inflamed her ganglion nerves. The problem is no one had ever heard of it on the West Coast. And every test we did kept coming back negative because you have to eat to see it. And so I literally had a doctor at Children's Hospital sit me down and be like, ma'am, you need to learn humility in medicine and wrap your head around the idea that this is just functional abdominal pain syndrome and she's being a dramatic teenager. Maria?
Oh my God, I have the chills.
Nurse Ratchet.
It was a man, right?
Yeah.
Yeah.
Nurse Ratchet and Mama
I hate
Bear.
to be like that. I've been gaslit so many times, and I'm like,
you get it.
But the best is they always eat it after.
Totally. I mean, what was crazy? I mean, the Mama Bear Nurse Ratchet combo is not a good combo, and I was like, I'm gonna take a step back. I've minded my piece, and I went off as any mother would, and I'm like, you don't know my kid. She wants to go to school. She wants to experience her senior year. And I'll never forget it. We were watching Grey's Anatomy, season 15, episode 5. And she's like, Mom, that's what's wrong with me. That's what's wrong with me.
I have the chills.
And we looked it up. And sure enough, there's one doctor in the country that knows how to treat it. In Connecticut, we hopped a plane. We tracked him down.
Only one doctor in the country treats MALS?
Yeah. Correctly, I should say. There's been others that have tried, but he's pretty special, this guy. So
where is he?
Stanford Hospital in Stamford, Connecticut.
What's his name?
Dr. Shu.
Okay, just in case.
Dr. Shu is fantastic. And what's interesting is, I'm taking my binder of research and I bring it to him, and I'm desperate at this point because I know my kid. Yeah. She's not doing this for attention. And it was just the arrogance of the doctor not willing to keep looking. And
because they don't know what to look for. Then they get insecure.
Exactly.
That's the thing that people don't understand is doctors. We've had Dr. Zach Bush, triple board certified, sit on the couch over there. And not that specific one, a different one. This is new. But he sat there and he was like, the situation is that we go to medical school, we think we're going to help heal people, and then we wake up and we realize we're just pharmacists.
Yes.
And
yes,
that dynamic is something that I keep trying to share with people, not to poo-poo on the medical industry, because we need them and I love them and they've saved my life multiple times. But you have to know where to play your players as a coach. And healing isn't necessarily their game. They are taught, here are the symptoms, here's the disease, here's the medicine.
Exactly.
And so when we go in and we relinquish control over to them and think, heal me, save me, they're on their side, he said, being like, I don't know what this is. I don't know what to do.
But they have to give me an answer.
So they refer you to another person. They just do the referral game and they send you to all these specialists. And then the specialists are like, oh, let's operate or whatever.
Or call psych-in, which was so devastating to my daughter.
Psych-in. Oh, wow.
They, without my consent, by the way, which was a whole nother. But which there is a place for that, yes. But in my daughter's situation, she wasn't being heard.
Yeah.
And she wasn't
And that makes you crazy.
And that makes me crazy. And it's okay to say, I don't know, because medicine is evolving. And that's just what I wanted to hear. I call it practicing medicine for a reason. You're practicing. And when you're done practicing, you need to stop.
Yeah.
But it's evolving, and you're going to learn by listening to that patient. She was telling them what they needed. They just weren't willing to listen or think outside the box.
Yes.
And so they weren't willing to be like, I'm so sorry, I just don't know, but I'll keep seeking.
But
That's
also,
what
they're not
needed.
allowed to look outside the box either. If you really think about
That's
it,
true.
the other problem is they're handcuffed.
Yes.
To the teachings and what the institutions allow. And there's so many lawsuits that they have to be so careful. So they can't really think out of the box either, which is why I advocate for having a naturopath or a functional medicine person on your team that can help you with the stuff they can't.
Absolutely.
So she was treated for moles in Connecticut. Did you go back to the children's hospital doctor and inform them?
Oh, yes.
And what did they say?
They just ignored it. They just ignored it. I mean, what are they going to say? I was so beyond
But to help
frustrated.
the next person, you'd think that they would say, wow, thank you for sharing that with me. But they're just, it's ego.
It was an ego thing.
Yeah.
And that was unfortunate. But I mean, we were loud about it for sure. And that was always our platform, and always, my daughter's platform of like, I need to pay it forward. I need to, like, this happened to me. And she went, and what's sad is, so we were in Connecticut for a month. Doctor, she literally saved her life. She went into full kidney failure about a month. We were literally, and this was during quarantine time. Like, we got into surgery at the nick of time. It was January 2020. We were back there for a month because it was a massive vascular surgery. They removed about 3 centimeters of her diaphragm, her entire ganglion nerves. But it was the moment she ate, she got a hamburger and she came out of surgery and she took a bite and she just looked at me and started sobbing. She goes, "It doesn't hurt, Mom. It doesn't hurt." And the relief you finally feel of just being the victory of like, okay, the journey's just starting, but we've gotten there. Yeah. And of course we went back and we're like, this is what you need to know. Like, if you have, like, listen to the patient. And it was a long journey. I mean, she did go into kidney failure. We found out she ended up on a feeding tube, and it took a year to recover. But now she's strong and doing well, and has just kept on. And now she's a mentor for other kids who have gone through malls, and it's been really beautiful to see.
So sweet. Well, I'm going to tell you, this is the longest interview I've done in a very, very long time, Danielle. And I could probably go for 2 more hours, but I'm going to leave it here for now, knowing that you're going to have to come back and do more.
I would love to.
You are a wealth of information, and I'm so excited that that you are here today and sharing all of this with us. And I feel a lot better moving forward. I know a lot. And we're going to do our tongue tests.
You got it. I'm happy to.
Let's make sure we put all the resources in the summary below, guys. We'll have everything for you guys in there so that everything that Danielle shared with us is easily accessible for you. And also, we do blogs of every episode. They're at mariamenounos.com. What is the tab they have to go to, Kelsey, for the blogs? Just blogs, probably.
For the blogs, they go to Life Hacks.
Oh, Life Hacks. Yeah. You can go to Life Hacks and everything will be in there as well.
I love it.
Thank you so much.
Thank you.
All right, to see the video of Kelsey and I getting our mouth exams and the results, which are shocking, go to heelsquad.com. Go to Instagram, our Heel Squad Instagram, and you will get to see the video of that there. I am so excited for everything that I learned today. I hope you guys are too. If you liked this episode, send us a review. You can click the link in the summary of this episode to share that with us. It always helps us to hear your feedback, and especially when it's great. Maybe the bad feedback could be somewhere else, but on Apple Podcasts, we like everybody to see what we're about. And don't forget mariamenounos.com for the life hacks blogs. So this episode will be turned into a blog with all the really important information for you there. All the aha moments are always there, so you can listen with freedom and not have to take notes all the time. We do that for you. And also our merch is there too, so you can get some really cool merch. In the meantime, be nice people, make good choices, and be present.
Distributed by or on behalf of Maria Menounos or mariamenounos.com is for informational purposes only and may include information that is general in nature and that is not specific to you. Any information or opinions expressed or contained herein are not intended to serve as or replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury, and you should consult the healthcare professional of your choice regarding all matters concerning your health, including before beginning any exercise, weight loss, or healthcare program. If you have or suspect you may have a healthcare emergency, please contact a qualified healthcare professional for treatment. Any information or opinions provided by a guest expert or host featured within website or on company's podcast are their own, not those of Maria Menounos or the company. Accordingly, Maria Menounos and the company cannot be responsible for any results or consequences or actions you may take based on information or opinions.